Congratulations! You've made the important first step of scheduling an appointment with a mental health therapist. But what is counseling? What is therapy? What should you expect? Maybe you've been to counseling before at another location, or maybe you've never been to counseling and you're really wondering what it's about. There aren't any couches for you to lay down on. Nobody will be sitting behind you unless you want to lay down on a couch. At our offices, when you walk in the door, someone will greet you and offer you an intake paperwork. This is a packet of information that we need in order to be able to legally treat you. It'll have biographical information, consent to bill your insurance, and it'll tell you about our policies and the law regarding mental health therapy. When you're done with that paperwork, your therapist will come out and greet you and take you back to your room where you'll have your first session. This room will look a lot like your living room. It'll have a couch and a chair, and again, you could have a cup of coffee or something to drink back there if you'd like. We want you to be comfortable. In this session, your counselor is going to go over your goals. What is it that you're hoping to accomplish in therapy? They're going to ask you to tell them a little bit more about your biographical information. Where do you come from? What is it that you're looking to accomplish? How will you know when you're done with therapy? These will be the types of questions that your therapist will ask you as this session progresses. Now, I know it can be a little bit overwhelming, but we do encourage you to try to come every week. In fact, my clients, I try to encourage to come every week at the same time. Some therapists have a much more rolling and flexible schedule. Throughout your time with us, every so many weeks, we will periodically measure your goals. This helps us to understand the progress that you're making towards the goals that you said you have, and to ascertain as to whether or not any new goals have come up. When you've reached your goals and you feel like you're in a good place to stop, we'll start to talk about what is clinically called termination, but what I like to call graduation. Now that can sound a little bit scary at first, because over the course of time, we trust that your therapist will become a trusted resource to you. However, this is the next step, stepping out from therapy to develop and use the new skills that you've learned through your therapy. If you have any questions at all, please don't hesitate to contact our customer care team. You can call our office, you can Facebook message us, and you can even chat with us online via our webpage or through one of our Facebook pages. We're so excited to start this journey with you, and we believe that change is possible.